Well, a growing number of children are coming down with MISC, multiple inflammatory syndrome. The total number in LA County is 75. Now, this is a rare condition related to COVID-19, and shockingly, more than 3/4 of the children were Latino. I talked to a pediatric intensive care doctor from Dignity Health to find out more about MISC. A fever that doesn't go away, inflamed body parts, red eyes. Multi-inflammatory syndrome is putting children in the hospital, and in LA County led to 1 death.
It's a disease similar to some of the other diseases we've seen in children called Kawasaki's disease or toxic shock syndrome. And it seems like it causes inflammation of blood vessels, especially blood vessels around vital organs such as the heart and the kidneys.
Dr. Richard Kang is a pediatric intensive care doctor from Dignity Health Northridge. In all, there have been 75 cases of MISC. All were hospitalized, and almost half were sent to the ICU. It's considered rare, but Dr. Kang wants parents to be on the lookout nonetheless.
Parents should know some of the signs and early signs because it's a very treatable disease as long as you treat it early. If children present late in the process, it's much harder to treat, and so, it can be fatal depending on how severe the illness is.
What to look for? Early on, a big tell might be fatigue.
Especially if your child is active and they're just unable to even do simple activities without getting extremely tired or fatigued, then that might be a telltale sign. And that's a sign probably that their heart is affected.
Dr. Kang believes the fact that 76% of MISC cases were Latino children is because that community has had more COVID-19 infections than any other community.